A very good day to all of you, my dear students. So today we are going to learn the first lesson from grade 11 Health and Physical Education textbook, which is Building a Healthy Society. So in the previous grades, we have learned what total health means. And now we are going to learn about health promotion. In Sri Lanka, there are many school health programs which are there to create a healthy and active young generation. The main goal of them is to make the most of academic opportunities to improve students' health and help them develop skills, personal skills, and also in their families and for their community health. So these programs also focus on creating a healthy school environment which carries out immunization efforts, which detects health issues early, and educates families about health. We'll be talking more about this in this lesson. So, you might have already learned about different areas of health promotion in previous years. So, you are familiar with the idea of total health and the factors influencing it and the steps you need to maintain. In this lesson, we are going to focus on understanding health promotion and how it contributes to the quality of life. So if we look at the definition of health promotion by World Health Organization, it simply means it's all about helping people gain more control over their health and improve it. So it goes beyond just focusing on individual behaviors and looks at a wide range of social and environmental factors that can make a difference. So it's going beyond the individual behaviors. That's what we have to remember. So here you are looking at a diagram showing different methods of health promotion, or else the strategies that you can follow to gain health promotion. So some of those strategies are formulation of policies relevant to health promotion, obtaining community participation for health promotion, recruitment and organization of services necessary for health promotion, developing skills required for health promotion, and building a health promoting environment. We are going to talk about each of these strategies separately. When it comes to centers of health promotion can be carried out in various settings. It could be your home, it could be your school, village, city, hospital, and even your workplace. All these places can be possibly converted to health promoting centers. So in this part of the lesson, we are going to talk about the actions that can be taken to develop school health promotion. And if you go through them, you will find out that they are almost same as the strategies that we talked earlier on health promotion. So we are going to talk how these strategies can be applied to school health promotion programs. It's important to formulate health promotion policies in order to create an environment which is favorable for the promotion of health within the entire school system. So when formulating a health policy, the first step is that you have to identify the current health issues that your school is facing. And then you have to find means or ways of eliminating or reducing those factors. So once the policy is formulated at the end, the laws and circulars have to be made in order to implement the policies. So as students, you can come up with different types of health promotion policies. For example, students should be provided with adequate knowledge on health. That is one of the policies that a school can have. And then the schools can come up with the health promotion policies like providing clean drinking water, making them available within the school. And then schools also must have hygienic canteens so that they can provide hygienic and healthy food for the students. And the school environment should also be accident free. That is also one of the policies that you can come up with. If there are large trees with branches hanging over there which can cause accidents, then one thing you can do is you can prune out those branches to create a school environment. So that is how first you have to identify the challenges that you are facing or any health issues that your school is facing. Then you have to find means of eliminating or reducing them. Another method of health promotion is building an environment favorable for health promotion. Let's see how we can do this at school. You have to think about improving your physical environment, the mental environment, and the social environment. So when it comes to the physical environment, some of the things you can do is providing clean drinking water and providing adequate toilet facilities for students. There should be at least one toilet per 50 students. That means if there are like 150 students, there should be at least 3 toilets in that school. And then think about the mental environment. What can you do to improve it? You have to make sure that the students are not insulted and they are treated equally, and there are counseling services for the students and so on. And when it comes to the social environment, you can think about safeguarding democracy. That means the students have the freedom of expression and availability of space for group activities. Maybe there are group activities during Vesak, and then there are Shramadhan activities. So all these kinds of activities can be referred to as group activities. Also the presence of clubs and associations for different activities, and when there are the programs to spend leisure time for the students in a useful manner. So all these will help to improve the social environment. So it's not only the responsibility of students, because of course the students cannot implement all these things alone. They should have the help and the support from the principal and the education authorities, teachers, and other responsible ministries. And another strategy in health promotion is community participation. So even if it's a school health promotion program, one can get the assistance from parents and other members of the community. Suppose it's a dengue eradication campaign carried out at the school. So the parents and other community members, they can also be involved in this. You can get their involvement. So that raises their awareness and also interest in dengue eradication, and they might even implement similar programs in other places in the community. So that's basically the whole idea of involving a community in a health promotion program. Another way of health promotion is developing skills required for health promotion. So it's important that you improve the skills to develop health promoting behavior. For example, if you take good decision making, that is one of the skills which is important in health promotion. because think about the supermarket, the types and the varieties of food you have there, and you need to have the good decision making skill in order to select healthy food from what is available in the market. And another skill would be effective communication, whether you have the ability to understand what is implied or what is expressed, uh, and then whether you can communicate it effectively to someone else. So that is a part of effective communication. So to improve the health status of a school, a workplace, or village, it's we need some behavioral modifications, such as consuming healthy meals, following an active lifestyle, and being able to face and manage life stresses. So, all these are skills that you need to improve for health promotion. So, it's important that skills are developed for health promotion. The next strategy of health promotion that we are going to talk about is provision of required services for health promotion. So we know that the government carries out school health inspections to improve the health status of school children. That means all students must undergo school health inspections during specific periods, so that if there are any health deficiencies, these can be identified earlier and they can be corrected. And you might also have the experience that these staff, the medical staff, they provide you with iron and folic acid tablets when there are deficiencies. And also there are instances where the PHI, or the public health inspector, carries out annual school sanitation surveys and identify any areas which can give rise to illness and accidents. So the schools and the relevant authorities are responsible in providing required services for health promotion at schools. So before starting any health promotion activities in schools, it's important that you do an initial evaluation to find out where the school's health promotion status is. So for that you can consider several criteria as shown here in order to implement school health promotion programs. So in the evaluation, you have to find out, and the school has to accept the need to follow established health policies. When you come up with health policies, the school has to accept the need to follow those policies. And also when you have a set of health policies, there might be certain health policies which cannot be implemented right away, or which are difficult to actually practically follow at school. So out of the list of health policies, you have to recognize which ones can be carried out by the school. So that is another criteria that you have to consider. And the other one is you have to identify methods of carrying out these health policies. Once you come up with the set of policies that you can implement, you have to find ways and means to implement these health policies. So these criteria are included in the School Health Promotion Circular issued by the Ministry of Education, Sri Lanka. So here you are looking at the circular of school health promotion issued by Ministry of Education. So you can have a look at this circular. It's out there available on the internet. You can download and go through it. So there are some laws which are applicable to school health promotion in Sri Lanka. So one of them is compulsory health education from grade 6 to 9. So you of course know that you have health and physical education as a subject from grade 6 to 9. It's compulsory. And then the school should provide health facilities, adequate health facilities for the students, such as ensuring that the well is protected. Well here means assuming that the school is providing drinking water from a well. So it might not be the case for schools in the cities. So, and provide one toilet per 50 students. So there should be at least one toilet per 50 students. And like I said before, if there are 100 students, there should be at least 2 toilets. And creating an accident-free school environment. Have to make sure that the buildings, if there are any trees and other premises, are accident-free. Carry out dengue eradication programs. That is also a must, a compulsory program that should be implemented at schools. And another one is prohibiting the consumption or sale of unhealthy food. You know, carbonated beverages and all those unhealthy food should not be available in the school canteens, and they are also not available in the school canteens. And prohibiting the possession or use of cigarettes, alcohol, and drugs. It's of course prohibited. So before we wind up the session for today, I would like to summarize the things that we learned. We learned what health promotion is and what are the strategies that we can use to develop health promotion, and we used those strategies as an action plan to develop school health promotion. And then we talked about the criteria for school health promotion evaluation. And finally, we talked about laws applicable to school health promotion in Sri Lanka. So there's another part of this lesson coming up. Please stay tuned. Goodbye.